Hi guys, and thank you so much for tuning in. I am super excited to be with an amazing pregnant and partner company today. Today I'm with Iqra and Greg, who are osteopaths with the Osteopathic Centre. They have multiple locations throughout Singapore, and I am so excited to learn more about osteopathy and how in particular it can help mums and babies today. So first of all, guys, can you introduce yourselves?
Hi, so thank you for having us. My name is Iqra, a UK trained osteopath. I've been in Singapore for around 5 years now, and I've been an osteopath practicing for 10 years. My keen interest is in university was sports therapy and pre and postnatal care. So I chose this as one of my electives, and once I graduated from uni, I worked in a private obs and gynae clinic. I treated everywhere from beginning stages of pregnancy to postpartum, and worked within private and NHS sectors.
Hello, hi guys, I'm Greg. I'm also a UK trained osteo. I've studied in the UK. I've been in Singapore for now 7 years almost. I'm from France in the first place. Been working here for 7 years now. So my interests are mostly around pregnancy and babies, but I also work with sporty people, and I see the average patient as well. I've been working a lot with the babies and the moms since I've been in Singapore. So it's been a while now.
And something I've recently learned about you guys is that you study together. Is that right?
Yep. We studied together. Greg was in university with me. He was one academic year below me, and we had a buddy system in uni where you would shadow the student in the year above, and so I've known Greg for over 10 years now.
So I used to shadow Iqra. I was the shadowing guy, and learning a lot from her at the time.
This would explain why I have so many pregnant and popped attendees and clients that say how they transition often between the two of you. A lot of people say that they see Iqra and they also see Greg.
Yeah, exactly. So it's really collaborative here, and a lot of the times if a patient can't get to their practitioner that they want to see, we take thorough notes, and because we came from the same school, we have the same style of treatment as well. It's very, 1 week a patient can't see Greg, they'll come and see me, and vice versa.
Okay, and that's really interesting because you said in terms of style of treatment, which leads me on to a question that I get asked a lot, but that also I don't always feel qualified to answer, which is what is osteopathy and how is that different to chiros and physios?
So we get asked this a lot, okay? A lot. In essence, it is difficult to describe because they are all forms of manual therapy. It is the main difference between them is we treat osteopathically. So osteopathically means we have our own forms of examination, diagnosis, and treatment. So a chiropractor might treat a little osteopathically, and a physio might treat a little bit chiropractically. It all merges together. We're all in the same kind of bubble in terms of manual therapy, and pretty much treating the same types of issues as well. So musculoskeletal issues. The quintessential thing about osteopathy is we believe structure governs function. So we take structure very seriously, and if we help to make the structure of a person the optimal, it will help with their function later. Also very holistic in the way we treat. So for example, if a patient comes in with hand pain, we're not just purely looking at hand. We're looking at elbow. Is there an impingement or issues coming from neck? Is there an issue with shoulder? Is there a referred pain? Is it nerve? Is it muscle? Is it tendon? We're looking at the whole picture. And hand pain for each person can be different. So a hand pain for a rugby player compared to a boxer might be different. Or someone who's a sedentary person, or someone who's breastfeeding all the time, who's kind of adopting very awkward hand positions. It might seem a little bit different to someone who's just done boxing like 3 times a week. So we're looking at the person's individual picture as a whole and then treat accordingly.
Okay, so it's a blended approach of some of the things might seem similar to how chiropractors do, some things might seem similar to how physios do, but you're looking at it from a whole perspective, from a holistic perspective, looking at how aligning and making sure the structure is there so that everything works.
Yeah, and there's also like as you said, a little bit of overlapping between techniques. So we might see a technique that is very similar in the chiro world compared to the osteopathic world, and same with the physio. So we use different manual therapy techniques that are osteopathic but also sometimes similar to the other professions. The idea of but like bringing back mobility to the body is something that we share with chiropractors and also physios. So it has to be overlapping, which is good as well because we can work together pretty well. We're completing each other, I would say, especially physios and osteos. I like to explain that to patients when I compare physios and osteos. And if you want to make it a bit black or white, they work a lot in the rehab world and we work more hands-on. Of course, we can do a lot of rehab and they can do a bit of hands-on work as well. But this is how we differentiate from both professions. And that's why we can work all along together as well. And that's why like it's good to work closely with physiotherapists and sometimes chiropractors as well.
And am I right in thinking that around the world this is becoming much more of a mainstream treatment solution that is being recognised?
Yeah, so it's being a lot more recognised in the UK. So obviously we trained from the UK and it's been accepted for a few years in the NHS. So very much so before it was a complementary therapy, something that is outside of the health model. Now it is in certain boroughs, GP can refer you to an osteopath, which is great for the profession, but it also shows to the level that we train and the amount of clinical hours that we do and how helpful we are for musculoskeletal issues.
Bringing it specifically to the audience in question, at what point do women, when they're pregnant, typically come and see you, or when do you think they should come and see you?
They can come throughout all trimesters, but we are really careful before 12 weeks. So before the 12-week mark, we are a little bit more gentle in the pelvic and lower back region. But it's not to say that you can't come in for an existing issue either. But very much so between the second trimester all the way to the fourth postnatal, very sleep deprived trimester, we see people throughout their whole pregnancy. So we help alongside doulas, midwives, nurses, obs and gynae. We're pretty much there throughout your whole journey and beyond. So you can come at any time. A lot of the times people feel they need to come in just for a pregnancy-related issue, and that's not the case. So if you're already dealing with knee problems or tennis elbow, or if you're having headaches, yes, by all means you can come. It's just before that 12-week mark, we're a little bit careful.
So what type of conditions do you typically see during the gestational pregnancy period?
So there's many. so some of the common things that we see is probably pelvic girdle pain. That's probably one of the big factors. It happens towards the second and third trimester. It affects 1 in 5 women. If you have pre-existing low back pain, 50 to 70% of people might develop pelvic girdle pain. It used to be called symphysis pubic dysfunction. And essentially what it is as the pregnancy progresses, the curves in the lower back get even more deeper. So we call that a lordosis. So that lordosis gets deeper. When the uterus grows, the baby kind of projects forward and downward. And one bony element at the front of the pelvis is your pubic bone. Pelvic girdle pain basically is when there's too much pressure on that pubic bone, and it's really specific. Like a lot of the times patients will be like, it's a specific pain, I can kind of pinpoint where it is. And it typically manifests as pain on one leg, anything that forces you to weight bear on one side. So turning in bed, getting in and out of a car, climbing stairs. The most common thing I see is people putting on trousers or underwear, because there is an element of being on one leg and bending forwards, and that is a lot of the times when you're like, I have to sit and do it. So this is a common, very, very common condition that we see. And how we go about treating this condition is that obviously there's advice and tips that we give women. So steering away too far from your center of gravity. So a lot of the studies suggest too much or too little exercise can be a help or a hindrance. So you have to exercise within your realm of discomfort. So you don't want to get out into a discomfort zone. So a lot of the times if you do squats, lunges, don't take it too far. If you're wanting to strengthen certain areas of your lower back, putting a band or an exercise band around knees while doing clams, open, closed shell, that kind of stuff can help. The biggest thing that can help is obviously coming to see us, because what we do is we do some indirect techniques on the pubic area, so it's not too invasive. And we also try to calm down the structures that are overworking. So like I mentioned, that pubic bone is kind of inflamed, and anything that attaches to that pubic bone, like the inner thighs, the adductors, work really hard. Those muscles tighten and they tense. So we do a lot of techniques to loosen those muscles. Sometimes I get partners to come in and I teach partner how to do at home for mother as well. So it's easy, it's basic. You just have to guide partner in. That's one element. We work heavily on like psoas, hip flexors, glutes. They tend to tighten up, and lower back. It involves a little bit of soft tissue, a little bit of articulation, but most importantly, getting partner to come in and getting mother to do it regularly.
And that's the most common thing that you see is pain in that area.
Pain in your anything in and around that area, but also anything involving the lower back, anything involving the glute. One of the biggest things that we get is like, we get this, pregnant or not, is disc problems. So a lot of times patients will come in and be like, my doctor told me I had a disc problem. And then it's like, I've got a disc problem for life. Not the case, okay? It is very much an umbrella term. Most discs retract. So what people refer to as a slip disc, it's a spectrum, anywhere from a bulge to a complete herniation. Around 6 months to 18 months, it will tend to retract anyway. So that's one thing to know. But if you do have a disc issue and you're during pregnancy, it can cause a bit more issue. And we are known for lower back, so we have loads of techniques to help alleviate the disc. So a lot of traction techniques, advice and exercise, and even in some cases using a brace if they need to. So some of the common things we see is lower back, disc, pelvic pain. Another common thing that we see that I think is really important is something called PIRIFORMIS syndrome. And that is basically a fancy way of saying there's a muscle in the glute, it's called the piriformis. The sciatic nerve is like a rope. It goes anywhere from the lower back all the way down the foot. There's certain points within that nerve that can get impinged. And during pregnancy, that muscle works really hard. So this is why examination and case history is really important, because if I just keep treating the lower back, it may never help that issue because it's actually coming from your glute. So we try to analyze if that's the correct thing to do, and then we'll work on that piriformis and obviously give stretches as well.
So having talked about some of the pain issues that your pregnant clients might be experiencing, either something that they had before or something that's been aggravated during the pregnant phase of their life, one of the things that I see with a lot of pregnant women is that they're concerned about swelling, be that in their lower extremities or other parts of their bodies. Is that something that you help with or see a lot?
Yeah, yes. I mean, during pregnancy, it is super common to have swelling. Obviously, it's important to note that when it comes to swelling, sudden onset swelling, hands, feet, face, and high blood pressure must be checked straight away, because that could be a medical issue. So definitely go to your OBGYN for those. But aside from that, yes, swelling in the ankle, swelling in the hands. And the way we approach this, it's actually a really nice rhythmic technique that we do. It's called lymphatic drainage. And essentially what we're trying to do is all that excess fluid, we're trying to get it from distally, so feet, for example, through effleurage, trying to move the fluid to up the upper lymph nodes so it drains. So it's a very rhythmic, non-painful technique that we do, and we incorporate that with a little bit of muscle contracting, like calf pump, almost like mimicking a compression sock, if that makes sense, going back and forth, at the same time trying to drain fluid. Commonly, we work from ankle to hip and then wrist to kind of near the axilla, the armpit area. It is really effective. It's really effective. A lot of times women come in and they're like, I couldn't put my shoes on this morning. And now I'm like, wow, this is amazing. And again, teaching this to mother and teaches this to partner to help them do the same thing at home, super helpful. Giving advice on calf pump exercises and laying with feet above knee, knee above hip, also really helpful. So the technique that we use is rhythmic, it's non-painful, it feels good at the end, and a lot less swelling after.
So with the talking about the swelling in pregnancy, is it also something that you help out with in the postpartum phase? Because I see that a lot with clients.
Yeah, absolutely. As you know, postpartum swelling is very common, especially if women have had a C-section. We do the same techniques, but also postpartum swelling can develop into many other conditions, such as carpal tunnel syndrome, just based on the fact that you're holding baby awkwardly, long periods of times, a lot of compression of the wrist, and the nerve that innervates the hand gets compressed. We do the same techniques, and we ask mum to do, or partner to help mum as well. And obviously you give advice on more water, low sodium diets, and all that kind of stuff as well.
Okay, if there's anyone out there that was multitasking and didn't quite pick that bit up, I am going to say that carpal tunnel syndrome, or mother's wrist, as we quite often refer to it, is something that so many of my clients experience. So if you were multitasking, rewind, listen to that part again, make sure you know about the fact that osteopathy is one of the manual therapy treatments that you can do for that, because I think every single parent probably experiences that at some point.
Yeah.
Also the dads actually. So when the four hands in the household are painful, it's getting hard to do anything with the hands. So if everyone is suffering from their wrist, that's not ideal. So
because everything you do as a parent has got an extended thumb aspect.
Yes.
And I don't think people appreciate this necessarily when they're pregnant, that how you hold a baby for breastfeeding, how you hold a baby for bottle feeding, when you're pushing a pushchair, everything is there. An extended thumb. And I experienced pain personally myself for quite a long period of time, and I still have some weird nerve stuff that goes on with one of my fingers as a result.
Yeah, and it could be in many things. It doesn't have to be carpal tunnel. A lot of the time it can be something called TENOSYNOVITIS, which is the thumb, which is really easily identified if you just place thumb in the hand and drop the wrist. And if patients complain of a tightness or a pain, like you said, there's many conditions. There's carpal tunnel, there's trigger finger, there's trigger thumb, there's TENOSYNOVITIS for both parents. So it's a really important one. We work heavily on forearm for that. Some of us do ultrasound and maybe dry needling as well.
Yeah, and if there's anyone out there that is currently trying to handle this just by wearing a splint, splints are really difficult to operate as a mother or as a father trying to feed, trying to hold babies. So do try and come in and see if you can get some manual therapy so that you don't have to wear that splint, because I know a lot of mums will quickly go to that as a quick fix.
And as you said, like if you do that, close your fist and go down with your wrist, and you feel an instant acute pain there, that's a sign that
with the elbow extended, and then you drop the wrist. That's a telltale sign for TENOSYNOVITIS. For carpal tunnel, it's the Tinel's test. So we tap here, and if they feel like weird tingly, electric-y sensation, usually these three fingers can be a sign of carpal tunnel.
And the fact that we're using our wrists for everything else. So when you're done with the baby, you're on your phone. When you're done with your phone, you're on your keyboard. So you never let this wrist rest, and that can last for it's like a tendinitis, tennis elbow type of thing that would last forever. So you don't want that.
So Iqra and Greg, one of the things that I hear a lot of pregnant women saying is that they're getting more headaches than they've previously experienced.
Yeah.
Is that something that osteopathy can help explain?
Yes, help explain and hopefully help as well. So headaches can be for many reasons. There's many types of headaches, from migraine to tension headaches to something called cervicogenic headaches. So there's loads of reasons why we get headaches. A lot of the reasons can be from postural changes and hormonal changes. And postnatally, lack of sleep. Okay, so lack of sleep is a big one, not feeling fully rested. But in terms of postural changes, a lot of the times in pregnancy, the neck is really extended and the shoulders tend to veer forwards. The same thing happens when we breastfeed or we hold baby. We have long periods of time where we're kind of leaning in. repetitively, that can cause a little bit of shortening and strain in certain muscles that give nerve supply to head, shoulder, down the back, everywhere. Headache can also be from the base of the head. So we work for a lot of the structures cranially, and working for the structures in the neck, the upper back, shoulders, giving advice on sleeping positions, pillow. So it's a big one we do. Sometimes I do a little bit of dry needling as well into that area. It is obviously, like I was saying, there's many types of headache, so it may not suit that particular type, but in terms of tension, cervicogenic, postural strain, or even TMJ issues, because a lot of the time in lack of sleep or stress, a lot of women clench or they grind their teeth at night. And we actually do a lot of techniques within the jaw. Afterwards, you have a really great relief because we're trying to kind of gap the jaw from within. And that helps massively with people's headaches, especially when headaches come from here. And people usually complain of a headache going like a strip going across the forehead. It can also come from the jaw. So postural strains, yes, can definitely lead to headaches, and we can try and help with the posture to help with the headache.
So how soon after having a baby can people come in and see you if this is something that's still ongoing?
So a lot of the times it depends on their delivery, okay? So if they had a natural birth, they can come within a few days, literally, as long as they're up for coming. If it's C-section, again, we're careful around certain areas. We tend to say between 4 to 6 weeks, depending on how the C-section went, and being really careful between lower back, pelvic area, and pubic and pelvic area. But if they're coming in with something like headaches or neck pain, yeah, and if they had a C-section, and we're very gentle around neck and shoulder, they can come sooner.
And they don't need to be a pre-existing client for something that they had in pregnancy or before?
No, not at all.
So a lot of these things might manifest themselves after giving birth,
yes,
right?
Yes. A lot, like we spoke about the wrists and the forearms, an area that doesn't really get used a lot is now heavily used. The same applies to the posture that we adapt. Breastfeeding a few times a day, or holding baby up for long periods if you have colic baby, or different types of issues, posture will change and adapt for those issues. So yeah, a lot of the times people can come, they don't have to come during pregnancy, and they can come at any time postnatally. It's just if you've had a C-section, it's good to wait about 4 to 6 weeks.
So Greg, you are sitting here actually with a very apt sign applied by you, because you are increasingly becoming known on the Pregnant Pop network for the work that you actually do with babies. So I would love it if you could explain to the people that haven't yet thought about osteopathy for babies, or who might initially think that sounds like quite a scary, manual therapy, babies, what are we doing? Can you explain how osteopathy typically helps babies and when they normally come and see you?
Yeah, when it comes to babies, eventually babies are like little adults. So we try to achieve the same thing that we try to achieve with the adults. But when it's a baby, and obviously you need to deal with the parents, and you need to be reassuring and very gentle. The techniques are almost the same. They're all very gentle. There is no adjustment, there is no cracks, there is nothing like that. What we're trying to achieve is the same thing. So, as Iqra was explaining earlier, the muscle imbalance, the general imbalances in the body that an adult can encounter, babies can also experience that. There is a list of conditions that we often see, but it's often due to something or some event that would happen during the pregnancy, during the delivery, after the pregnancy. If I give you just a little overview of the condition, it's basically head and flat head. We work on the latching issues as well, and digestive issues. That's the main thing that we see when we treat babies.
And can you explain to us in more detail then how these things would be initially noticeable to parents? So maybe starting with the flat head syndrome, which I know a lot of parents are concerned about, either how to prevent it, but also if they've noticed it, how would they notice it, and what would be the approach that you would give?
So when, like, for any condition in babies, people are often wondering when to bring the babies. So generally speaking, it's always good to come to see an osteo within a month. So as you were saying before, depending on the type of delivery, if it's been traumatic, if it's been smooth, the parents are feeling, the mom is feeling or not to come to see us early or later. If there is a rush, if they want to take care of something specific, then there is no issue coming very early. So often people are asking me, how long should I wait until I bring the baby in? It can go from 3 days to a month. I would recommend maybe a week or two. That's usually a good timing. And then, depending on the delivery, obviously, it can be sooner or later. Back to your question, so the flathead syndrome. So people, we use that term flathead syndrome, but it's a bit of a harsh term, and I like to use not a fancy, but a specific term, which is called plagiocephaly. And this is, the definition of that is basically flattening of a part of the head for some reason. And we get into those reasons in a bit, but the baby, because of something that happened during the pregnancy, during the delivery or after the pregnancy, end up with a bit of a flatness, usually on this part. As osteos, we really try, as you mentioned before, try to identify the root of the problem. What is important to understand is the flattening happening because of something specific, and are we the right person to go to when this happens? So depending on the reason for the flattening of the head, we're going to work on different ways. So I'll give you an example, and it's what happens often. Depending on the positioning of the baby in the womb during the pregnancy, some pressure can be applied on the skull or on the neck and create some tension. So if a baby comes out with tension and flat head, and with osteopathic gentle techniques and everything that is related to the musculoskeletal system, that's what we're working on here. We're trying to loosen up everything to put the baby in the right direction to recover, and for all the system to develop itself and the flattening to go away as fast as we can.
Or potentially not develop in the first place, from what you're talking about. So if a delivery has resulted in babies having some tension, I'm assuming that could also mean that they might then have a propensity to sleep on a certain side, lie a certain way, which could then lead to more of a flat head. Am I right?
Yeah.
From what you've said.
Yeah, and it's usually, I think, the most common reason for flattening of the head. Because I mentioned before what could happen in the womb, but what can happen after is like, yeah, the baby end up with the bad habit, turning the head to one side, and people need to not forget that from 0 to 6 months, baby skulls are very malleable, very soft. So it can go both ways. It can flatten very easily, but it can unflatten very easily as well. Mm-hmm. So if they turn their head to one side and keep sleeping on their back, they're going to flatten, and they're going to flatten more. So that's why it's important, and that's what we do during sessions and after as well, to do exercises to engage them the other way. Try to recommend to people to get their baby to move around and to spend as less as possible time on their back when they're not sleeping.
And what other typical things? So you mentioned, I think previously, that there's 3 main areas that you typically see mums with babies or dads with babies coming in with concerns. So one is the flat head syndrome, and aesthetically how that might display itself, but also with feeding and in particular latching. So what do you see most commonly people's concerns coming in and around the digestion and the feeding? What's the top concern?
So but it's interesting because there is a strong connection between the flat head possible syndrome, the neck, and the latching. As you were mentioning before, like people having headache because of the jaw issue. So for babies, it's also you can have a latching issue because your neck is stuck on one side. So there is a strong connection between all those elements. And this is what we see the most, a mix of those elements as well. I want to mention first that we work a lot with the whole healthcare world professional around pregnancy. So this is like this big ecosystem that is amazing in Singapore, as you know. So we work with people like you, a lot of lactation consultants, midwives, obs and gynaes, and dentists as well. And all those people are usually redirecting the patient to us. So it's kind of easy for us because when parents come with the babies, they already know what to address because they would have seen a lactation consultant that they would have recommended to see us because they spotted an issue that can be treated by us. So apart from working on the actual head, we also work on the whole neck and jaw area. So if, and I give you like an example, if the baby and the mom seen the lactation consultant, the technique, the sucking technique is good, but the jaw feels a bit tight, the lactation consultant gonna send the baby to us for me to work on the jaw muscles, basically. This is one option. There is also something that's very common, and this is more to do with the dentist. So baby who would be born with a tongue tie, with a lip tie, would obviously have an oral restriction, not allowing them to latch correctly. I work with the dentist for them to diagnose. We wait for the dentist to operate if it's needed or do an intervention, and then work on loosening up everything. So that's for latching issues. And then with the parents, work on the tongue technique, try to explain to them and show them how to work on that at home, and give a bit of a workout plan to do with their baby at home.
So that would be things that both the mother and father could learn to do to support the work that you've done that maybe has been identified by a lactation consultant or a dentist.
Ideally, it's been identified by one of them. And then it's for us to try to apply what they ask us to do.
And a lot of those exercises that you would be doing, or in fact all of the exercises that you would be doing and that you could instruct parents to do at home, are gentle ways, like you say, to work on the structure, the muscles that are in the jaw. Yeah.
So keep it gentle, explain to the parents, reassure the parents, and explain that nobody is suffering, but it can be a bit unpleasant. And it's exactly the same with a neck tension or a torticollis. So a torticollis is too much muscle tension on one side of the neck, and that would push the baby to turn the head to one side rather than the other.
I imagine this is very similar to how I often have to explain things to a lot of parents, which is imagine how this would feel yourself. You know, like these are exercises that you're doing in a much more gentle version, but very similar to how they would be on adults. Am I correct?
Yeah.
So you can imagine how that feels. We know how it feels to have a thumb or a finger, pushing on a tight muscle, gently. So, like you said, they're not suffering, and in actual fact, they do get used to this, don't they? Like over a period of time, they become to learn that this is ultimately going to make them feel better. Roll forward a few sessions, and those babies are entirely different during those sessions, and really noticeably happy at the end of each session. I mean, I think that's one of the key things I want people to understand is actually the benefit at the end of this. You can have almost a totally different baby.
Hopefully. Yeah.
I mean, I'm sure you'll get into this, but babies that are feeding better because of the tension that you've been able to release for that, but also sleeping better. Have you had any requests to do appointments that are at a particular time of day just because it's nap time? I'm sure you have.
Yeah. And people would like come because they just want to, like, there's no specific issue, but the baby's not sleeping and the parents are not sleeping. So why not do a little session to calm them down? And sometimes that's what we do as well. It's like bringing a baby to the spa to show them that the world is not stressful and it's all good, and to calm them down and calm the nervous system and calm everything. And if you calm them down, calm the parents, and it's a good feedback loop, and everyone is doing better. Just to get back to the feeding, because the relationship with the baby, and I know that it can be very emotional and very hard for moms when they struggle to feed their baby, whatever reason it's for, and it's not just coming from the baby, but sometimes it can be also on the mom's end, who would have kind of a low milk supply or overflow milk supply, and that those elements are also to take into consideration from my point of view. That's why we talk about it all together, and we talk about those topics. So even if it can get a bit emotional, it's important to take into consideration what the mom is going through as well. I don't know if you mentioned it before, but we also see a lot of, it doesn't have to do with the babies, with the mom, but of milk blocked ducts, and that can be excruciating. You want to talk about it?
Yeah, so blocked milk ducts is obviously a real hindrance to feeding, and a lot of the times it can, if the milk duct is left alone, it can lead to something called mastitis, which is like an infection in that blocked milk duct. And a lot of the time mothers will come in and it's painful, localized, red swelling, and they just can't unblock it. Heat can help, gentle massage can help, but what's really, really super effective is the ultrasound. So we use an ultrasound therapy, and in that ultrasound therapy, it's non-invasive, non-painful. You might feel slight warmth, therapy on the duct, and about 8 to 9 times out of 10 it unblocks, and it'll unblock within the session or an hour or two after. So so if you are suffering from painful, like cannot get that milk out of that area, swelling, redness, as long as you have the infection taken care of from a GP, ultrasound is probably one of the most effective things that you can do.
So you're able to do that targeting a particular problem from 2 different angles. So if a mother's concerned about feeding, and at the same time if the latch hasn't been great, which may be a reason why she's getting blocked milk ducts, one osteopath is able to kind of address both of those issues and talk about it and work together with the family.
Yeah.
Everything is connected, right? Everything is connecting. So working with the whole family. That's why also, like, we talk about the moms and the babies, but the dads are also something to take into consideration. We can get back to it later. I wanted to mention the digestive issue, a word that a lot of people use called COLIC. That's the main big umbrella word to explain something that we don't understand. So what COLIC is basically a abdominal area reaction to something. We don't really know why, but a very irritable abdominal area for the baby. We don't really know what's causing it, but as osteos, what we try to do is identify it, understand that, this is a colic symptom, and try to help ease the baby through it. I'm not saying that we're going to get rid of one colic, but we can still work on calming everything down around. And it's a bit like what you were explaining before, where we don't look at a single area, we look at the body as a whole. And when a baby is distressed because of some colicky symptoms, it's important to work on the rest of the body as well to show them that everything is going to be okay. So just to give you a bit of a technical information about the colic. We call it a colic when a baby is crying 3 hours a day, 3 days in a row for 3 weeks. That's quite extreme. I don't see many babies that are suffering that much, but the parents would call colic a ununderstandable crying, basically. So we don't know why it's crying. We don't know, they look a bit in pain, but they've been fed, they're eating well, they're gaining weight. Why are they crying always at the same time before going to bed, especially when we want to go to bed? And this is explainable because at this age, the baby's gut is very, very new, very immature, and every little detail can be irritating it. And often the feeding can be irritating it. So that causes a lot of tension. And as osteos, that's what we do, working on undoing, loosening the tensions and try to ease the baby towards more calm. So to treat colics, that's what I would do. Work on this area, but also work on the upper neck area, calm the nervous system, and work on everything that has a direct and indirect connection to the digestive tissue.
And that's something I
System.
can honestly say that I experience a lot with clients as well, with babies that have had periods of time where they've been crying quite heavily, you know, that really noticeable deeper cry that they can sometimes have, which leads to words like colic being used. I can feel in the baby that their body has got tense and tight.
Yeah.
And that is one of the main reasons why I actually refer and suggest people come and see osteopaths, is because if you can reduce that tension in their body, it makes everything else around easier. It makes feeding easier, it makes sleeping easier, and when you start to make all of these elements easier because they're not so tight and tense, you should be able to get to either the cause of the problem, or they're going to move through this phase in a much happier way with a lot more sleep, hopefully, for everyone involved.
Exactly, that's exactly what we're aiming for. Like, live through this phase in a happy way. So you can't get rid of all the little issues that you're gonna encounter. Like, this is part of the journey, but you can make it very livable and very more pleasant than what it is at the moment. So
I hope everyone has got a lot out of this session. I think the most important thing is, for me, is understanding that this is a manual therapy method that can go with you throughout your transition from pre-pregnancy through pregnancy, and then also your postpartum, and then going on and supporting that journey with your baby and for your baby. And the fact that it can become and is such potentially a normal part of what you would do in that fourth trimester phase, and that babies can get so much support out of this, and mums can do too. Is there any lasting thoughts that either of you would like to leave any mothers or fathers or pregnant people out there with?
Yeah, you don't need to have a typical pregnancy or postnatal or baby-related condition to come in. A lot of people just come in for a checkup as well. So it doesn't necessarily mean that. And it forms a good baseline, if anything. And just give you tips and advice that you probably didn't even know. You know, watch out for this, or, you know, watch out for this posture, or make sure that when you're holding baby, you just do it in this angle, even if you're not having any pain. But yeah, like you said, I think you summed it up really well. It is just a form of manual therapy, and we can work from head to toe and help you through your journey. So yeah.
yeah, and also important to tell people that if they're not sure, they can get in touch. Get in touch, email, send a message, ask us if something that we treat, and they should come and visit us. As I mentioned before, the dads, you guys are not alone, and they also can come, and they can also experience the same pain as pregnant women, in some ways, of course, not all of them. And yeah, it's important to just understand that osteopathy is part of the healthcare world, and we need you guys, we need the midwives, we need the obs and gynae, we need the lactation consultant to work all together, and the dentist as well. So it's more like a teamwork around the ecosystem of the pregnancy and pediatric.
Well, thank you so much, guys. I've really enjoyed speaking to you, and I'm really looking forward to not only the Pregnant and POTS network out there learning more, but also reaching a wider audience so that they know you're here in Singapore. You've got multiple locations, I know, so tell me again the locations that you've got.
So right here, right now, in the Arcade CBD, Raffles Place, and then Sigla, and River Valley at Valley Point.
Okay, so 3 locations throughout Singapore, and you've also got the Ask the Osteo question section on the website. plus people can reach you in the normal ways via the website. Yeah.
Yeah, any question, guys, just like click on the link and send us a question.
Thank you.
See you.
Thank you.